Hi class, my name is Angelica and today I will be presenting my informative lecture. So first I'm going to go ahead and present my audience. Perfect. Alright, and then before we start, I just want to give you guys my resources first. So I use Psychology Today, Mayo Clinic, and then also the U.S. Department of Health. So I'm going to go ahead and start off by asking the audience, how many of you guys have heard of bipolar disorder before?
I have.
Okay, perfect. Okay, so the term bipolar actually first appeared in the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders in 1980. Since then, we've only scraped the surface of understanding the mechanisms of bipolar. I hope to inform you, the audience, about bipolar disorder, diagnosis, as well as symptoms and treatment. Bipolar is still a very complex and up-and-coming mental disorder that that is growing in its recognition. Bipolar disorder is a mental disease with extreme mood swings as well as emotions. It consists of two central states of mind. You have the manic episode, in a high euphoria feeling of energy, confidence, as well as recklessness. And then you have a depressive episode where the person feels sadness, hopelessness, and in some cases, thoughts of suicide and death. Scientists are still studying what exactly causes this disorder. However, they have found that it is genetically linked and that it has to do with the brain's chemistry as well as its structure. Here's the brain. So the diagnosis for bipolar is a bit difficult in that there's no standardized test to test either positive or negative for bipolar disorder. This is similar with a lot of other mental illnesses. While keeping this in mind, there are 4 different ways to diagnose for bipolar disorder. The first one is a physical exam of the patient's overall health. The second one is a psychological evaluation of the patient. The third one is the patient to do mood charting log, so they would chart their moods throughout the day for weeks or months on end. And then the fourth one is for the doctor to use a diagnostic and statistical manual of mental disorders to compare symptoms and determine the diagnosis. As you can see, diagnosis of bipolar disorder is not black and white. As I mentioned before, bipolar disorder is a genetically linked malfunction of the structure and chemistry of the brain. There are 4 different types of bipolar disorder. Bipolar 1, bipolar 2, psychothymatic disorder, as well as a miscellaneous category or other, which may be combined with other illnesses such as Cushing's disease or multiple sclerosis. Although not one form of bipolar is milder than another, bipolar 2 tends to carry a longer depressive state or episode than bipolar 1. At this moment, there are no cures for bipolar disorder, only treatments. But most common and effective treatments include 1. Medication to level out mood swings. 2 is therapy such as psychotherapy or talk therapy. And then 3 would be other kind of miscellaneous treatments, which would include electroconvulsive therapy, ECT, or otherwise known as shock therapy, which in some cases may be able to correct the problems in the brain. As a review, bipolar disorder results in patients with extreme mood swings, emotions, and is categorized into 2 categories: manic episode, depressive episode. These mood swings may occur only a few times a year or as often as a few times a week. As you can imagine, loving or caring for someone with bipolar can be difficult. It takes patience to deal with their mood swings, their emotions, so it is very important to have tolerance while helping loved one through a depressive episode. Some key things to remind yourself and to remember while helping a loved one is definitely to be patient. Try to encourage the friend to be more open to you, which would include you to be a good listener. Try to invite them out of their house at either parties or to the movies or shopping, something. And then also try to keep them on track with their medication, their therapy, and their treatment. And then most importantly, is to be vigilant. If you think they are any threat to themselves or others, it's important to seek professional help as soon as possible. In conclusion, While educating you all on bipolar disorder, my hope is for you to realize that everyone is fighting their own battles, and to keep this in mind when we're going through the day-to-day life. Have patience and be kind. And then let me go and show you my audience again. Thank you for watching.